Hello everyone, myself Dr. Chetna Patil. I am a consultant neurologist working in Pune in Wakad location. Today I am going to briefly discuss with you regarding the do's and don'ts of epilepsy. So basically with proper treatment and precaution, the epilepsy patient and caregiver can get rid of all the hazards and all the difficulties which the epilepsy patient face. So most of the thing what the epilepsy patient should do in epilepsy should take proper anti-seizure medication, which is very important because if you miss the dose then it may provoke your seizures. Other than that is to keep the seizure diary to track your triggers, like you should not go to the high height or you should avoid using heavy equipments or heavy operating machines. You should have proper seizure diary of date, time, then what time the seizure had happened, was it minor seizure, was it a major seizure, then should have adequate sleep because sleep deprivation is one thing which can trigger even your sleep deprivation can trigger your epilepsy or your seizures if the adequate time is not there, and should avoid your screens. You should have healthy and balanced diet. Along with that, you should consult your physician very oftenly. You should have regular checkup with your physician because occasionally what happens according to weight, even the doses of the anti-seizure medicine has to be changed, and the caregiver should also in very helpful mode to the epilepsy patient because most of the time they get panicky and they get a very difficult situation like if the seizure happens. You should always avoid the things like you should not go to very high height or you should not miss your regular meal, should avoid taking alcohol and recreational drug. You should not suddenly stop your medication because if you stop your medication it can have your what we say sudden status, or it may have you sudden onset of seizure with severe intensity. You may need even ICU hospitalization if you suddenly stop your seizure or if you missed your medication. So taking your medication is very important. Along with that, you should avoid certain alcohol or certain recreational drug because they can lower your seizure threshold. You should carry a bracelet or you should carry some your identity card carrying a seizure so that you can specify which medications you are taking or which type of things you are carrying with you. Even you can have a little bit of midazolam spray with you so that in emergency it can be used. In emergency situation, never be panicking. Take the patient away from the harmful conditions. Make the patient in safety mode. Make him in left lateral position. You can just stay calm and keep him away from the dangerous acute environment, and seizure will get controlled by his own. Don't put anything in his mouth or don't give the onion or the chappals what people usually give during the seizure is there. And if the seizure persists for more than 5 minutes or more, then immediately rush to the hospital or contact the emergency ambulance so that he can take or relatives can take the patient to the nearby hospital so that he can receive the proper medication at proper time. So taking proper sleep, avoiding recreational drugs or avoiding the alcohol and other things, avoiding sleep deprivation, proper sleep and proper medication with care is hallmark for your epilepsy care. Thank you very much.